So we have Cari Ebert here, and her presentation today is called Beyond Buzzwords, Demystifying Neurodiversity and Neurodiversity Affirming Practices. Cari, thank you so much for coming back on.
Hey, thanks for having me. I'm excited to be here and have a in-depth chat with you about this topic.
I know, me too. This is going to be so informative. And let's go ahead and start with our bios. I'll go first. If you are not familiar with me, my name is Benita Liveback, and I go by she, her. I'm the host of the Speechy Side Up podcast and also co-owner of Tassel Learning. I'm an SLP with a passion for using AAC and literacy to support individuals with complex communication needs. I've spoken at ASHA and other local conferences. I'm also the author of the Lou Knows What to Do book series. And when I'm not being an SLP or posting a podcast, I enjoy playing tennis, having tea parties with my toddler, and trying out new restaurants. How about you, Cari?
Well, my name is Cari Ebert, and I am a pediatric speech-language pathologist in the Kansas City, Missouri area. I'm a therapist, a consultant, an author, product developer. I'm a professional speaker, and I am traveling always, always. If I'm not traveling, I'm doing webinars or recording podcasts. I feel very blessed to get to do what I love most, which is talk. I think the most important thing to know about me, though, is that I have an autistic son. And so it's really a different approach because I get to share my perspectives not only as a professional, but as a parent of a neurodivergent child. So I kind of come from both sides of the table, if you will.
I love that. And I learned so much from you in our last conversation. So I'm so excited for today. But
Yeah,
since
it's going
this
to be
is
great.
available for ASHA CEUs, can you go ahead and share your financial disclosures and then I'll share mine?
Sure. I am author of the Learning to Learn program, which is a book that I have written, and I will just briefly mention that in the interview. I do receive royalties from all book and product sales on my website, and I am being compensated for this presentation, and I may earn affiliate commissions from related products and services.
Thank you. And then I have ownership interest in Speechy Side Up LLC and Tassel Learning LLC. I'm also an affiliate for Simple Practice and Meaningful Speech and receive commissions for sales made with my code. I'll also be an affiliate for this event as well through Speechy Side Up. And then I am a member of ASHA. All right, so we're going to start with our introductions and backgrounds, which we've already kind of gone through, and then we'll jump into the challenges in autism discussions. Then we'll go to neurodiversity affirming practices and then traits of affirming providers. And as I was reviewing that slide, I was like, whoa, this is so good. So very excited for everybody to hear about that. And then the key message that you have for parents, and then we'll wrap up with some references and closing remarks. And by the end of this podcourse, we hope that you'll be able to describe 2 reasons why discussing autism with parents and caregivers can be challenging, define the terms neurodiversity and neurodiversity affirming practices, list at least 2 key traits of neurodiversity affirming providers, and identify the most important message for parents and caregivers after receiving an autism diagnosis for their child. All right, let's dive in. So, why is it so hard for some professionals, aka SLPs, therapists, to talk to parents about autism?
Well, I think there's quite a few reasons. I think that for many professionals, talking about autism can cause discomfort. And one thing that we have to acknowledge is that what you and I learned about autism when we were in college, most of that information is outdated and ableist. And so many professionals still view an autism diagnosis as a tragedy, if you will, as they view that diagnosis as an emergency diagnosis. And so unfortunately, for providers who are not yet neurodiversity affirming in their practices, then it makes it very difficult to talk about autism. And so oftentimes those early autism traits that we notice, we tend to use very deficit driven language to describe those autism traits. We'll say things like, it's really hard sometimes to say, oh, I see some red flags of autism, or I see some warning signs of autism, or there's a lot of deficits that I'm noticing in your child's development, or your child lacks the ability to, or your child doesn't do X, Y, or Z. And so when we start talking about describing autism using these negative terms, I think that for most of us, it causes a degree of discomfort. I've been doing this a long, long time. And I can remember years ago, not even feeling comfortable saying the word autism. And I would be sitting in a team meeting with my colleagues, and I would say something like, I think I'm going to have to bring up the A word with that one family. I mean, I would actually call it the A word because I didn't even like saying the word. What do you think about
Yeah,
that?
you can't be the only one. Yeah, you can't be the only one. It's definitely hard. For me, and it's interesting that you're talking about like the fact that if it's difficult for somebody to talk about it, then maybe they're not as truly neurodiversity affirming as they think. And so I think that that is a big eye-opening talking point. And I know we're going to get to what actually makes a neurodiversity affirming provider. Like it seems that you have to be, you're going to give us some points, but it seems like you have to be fully comfortable with having these conversations
Absolutely.
and
You know,
not be,
yeah, I was just gonna, sorry to interrupt. I was gonna
no, that's
say
okay.
I'm always writing new courses. I mean, I think I have like 10 or 12 courses that I already do because every time I write a course, it leads me down the rabbit hole to research something else. And the topic I'm really interested in right now and gathering research for is having difficult conversations with parents. I think the ability to have difficult conversations is actually part of our professional responsibility. I feel like for a long time early in my career, I just kind of danced around it. I didn't like to bring it up unless the family brought it up first. And then when we did bring it up, it was always like, well, now what? What's the recommendation now? And so I would just say that if you're not neurodiversity affirming, you will know because when you talk about autism, you will have a pit in your stomach. When you will have anxiety about having to have that conversation. Now that I'm neurodiversity affirming, and it's taken me a solid 4 years to get to this point. This is nothing that you just become overnight. And so my journey to shifting toward neurodiversity affirming practices, it also includes me becoming a neurodiversity affirming parent. And so now not only can I talk about autism without feeling uncomfortable, I can actually talk about the word disability. I can actually say my son has a disability. And a few years ago, that would have caused me great angst to even be able to talk about that. So just know if you're a professional, you need to give yourself some grace, but you need to understand that you need to get on the journey to becoming neurodiversity affirming and to making that shift.
Yeah. And I think that that book idea is going to be so helpful for so many professionals.
Yeah, yeah. Well, it won't be a book. We'll see if I can make it into a course first. I have
Oh,
like 10
perfect.
books I'd like to write, but who has time? I mean, I barely have time to sleep. So you know how that is.
Yeah. Awesome. Well, I think that those are all like very important points.
Let me go on to number 2. Can I do that?
Okay.
Yes, sorry. So the
It's
second
okay.
reason why I think it can be hard for professionals to talk about autism is a lot of times we have uncertainty about whether it is autism or not. So a lot of times we will see a child and we will one session kind of get autism on the mind, like, oh, maybe this child is on the spectrum. And then perhaps the next session we're like, oh, no, I don't think this is autism. I'm not sure exactly what this is. And so it makes it more difficult for us to actually bring up that conversation or bring up that topic. So, one thing to really understand is that autism is a dynamic disability. And what that means is the child's presentation of traits may fluctuate from one session to the next. And so, as professionals, we're often always second guessing ourselves, right? Is it autism? Is it not autism? And so, because of that uncertainty, the professional may not feel very comfortable bringing that up.
That's such a great point. And I think it validates where some professionals like do feel a little bit uncomfortable about bringing it up. So thank you for acknowledging that.
Yeah, you bet. You bet. All right. The third reason I think it can be difficult for professionals to talk to parents about autism is based on past experience, we anticipate denial from the caregiver. So if you're seasoned like me, which is a nice way of saying I'm old-ish, we have experienced that where we brought up autism and we have been met with an immediate, oh no, I know it's not autism. Sometimes there's been another professional who has already ruled out autism. So one of the most common things that I hear is this, oh yeah, no, my pediatrician already told me it's not autism because last time we had my child in for a well baby check or whatever, the pediatrician said, well, he looked at me when I called his name, so it's definitely not autism. Or no, she's too social to have autism. It certainly isn't autism. And so I feel like sometimes it's already just been ruled out by somebody who sees the child 5 minutes and has decided that there is one single characteristic that rules in or rules out autism, and therefore has already made the decision. And so now the parent has written that off, right? They're the caregiver, and they're like, no, it's definitely not that. The other thing that is very common is for friends and family to kind of say things to placate the worried parent. Oh, he's fine. You're overreacting. No, no, no. There is an autistic child at my son's school, and definitely that's not what your child has, right? So we sometimes hear that like, oh, you're just overreacting. And so I think that for professionals, we anticipate the possibility of being met with denial. And I think that leads to the fourth reason why it's very hard for professionals to bring up autism is I think we have that, I don't know that I want to call it imposter syndrome per se, but that concern that what if I don't know all the answers? What if I bring up autism and then parents say, well, now what? And you're like, well, I don't actually know. And if you're neurodiversity affirming, the last thing we're going to do is recommend go get 40 hours a week of behavior therapy. I mean, so when parents think, oh, well, then what are we going to do? And I think that for a lot of us, we struggle with, well, what is the answer? What is the solution? And there isn't an easy answer to, well, if he is autistic, what do we do about it? And so I think that's another reason why we don't like to talk about it. One of the things that's interesting is parents will often ask about their child's future. If it is autism, then what does that mean? Will he be able to go to college? Will he be able to live on his own? Will he be able to drive a car? So for me, whenever a parent brings up the future and has concerns about their child's future, one of the things that I always try to do is kind of keep them focused on the next 6 months instead of focusing on what's going to happen in the next 6 years or the next 16 years. I always say, oh, I don't have all the answers and I don't know, and we certainly can't predict. But what I would like to do is talk about what are your concerns and your priorities for the next 6 months for your child. And I really try to just bring it back to something that we can write goals for and we can focus on now. And regardless of if it's autism, formally diagnosed or not, I think that we're always thinking about regulation, connection, and communication. Like to me, those are the three first big topics, whether the child has a formal diagnosis or not. I would like to share one term that I've started using recently for children who do not yet have an autism diagnosis and where I'm not sure I'm ready to like go down have that conversation quite yet, is I will say to the family, I've been working with your child for a short amount of time, and one of the things I'm noticing is that your child has some social learning differences. And that's my new favorite term, social learning differences, because that way I can talk about all the autism traits without necessarily saying autism right now. Please understand, it's not because I'm trying to sugarcoat it or anything like that. It's just I'm still getting to know the child. I'm documenting what are the developmental differences that I'm seeing. And a lot of times what I'm seeing are some of those social learning differences. And so I find that I can spend several weeks then talking to the family about these social learning differences. And then when I feel like I have a really well-established relationship with the family, I have a really good idea of what's going on with the child, I can say to the family, all these social learning differences that we've been talking about over the past couple of months, I just wanted you to know that these are all traits of a child who is autistic. These are all autism traits. And so I don't know how much about autism or if you've ever thought about autism, but when you're ready, I'd really like to have a conversation with you about that. And I don't just bring it up and like say, well, you need to just go get a developmental evaluation. Like that's never my first recommendation. If I'm going to bring it up, it's going to be because we've been talking about it, all these different traits and understanding that if a child does eventually get an autism diagnosis, that diagnosis is nothing to fear. Okay. That diagnosis just explains your child's neurology. That's all that diagnosis does, is explains neurology, explains that they're wired differently. And so anyways, I just think that those are some of the reasons why talking about autism can be difficult.
Yeah, no, those are all really great points.
And one of the reasons I think so many professionals struggle with shifting to neurodiversity affirming practices is it forces self-reflection, and it forces us to actually think about and talk about are implicit biases. Every one of us has a bias about autism based on what we were taught in school, based on how we perceived it over the years. And so it's a lot to unpack. I'm going to be honest with you. It is a lot to unpack because self-reflection is an executive function skill, and that is a hard one. We don't like to think that we've possibly ever done harm in our job. We don't like to think that we've ever possibly used approaches as therapists that caused any harm to any of our clients. And I think that we all know that we listen to the autistic community. There is, I have to think if I have it right here or not. I'm just going to grab this one book because on
Okay.
page 29,
I love that.
oh, I do. I know. So this book, it is called Sincerely Your Autistic Child, What People on the Autism Spectrum Wish Their Parents Knew. Okay. And so because I have an autistic child, I'm like, well, clearly I need to read this book. And on page 29, I was like almost in tears. Let me just put my eyes on. When you get old like me, your eyes don't work anymore. So page 29, I wish I could have grown up in an environment where I wasn't constantly treated like I was broken. That's huge. I mean, we don't ever want to suggest that there's something wrong with an autistic individual. So sometimes people will ask me, Cari, like, what's the best advice you would give a parent of a newly diagnosed child? And I've thought long and hard about this. And I think it would have been life-changing for me had someone said these words to me 17 years ago when my son was diagnosed. Okay, here's what I wish someone would have said. Love and accept the child right in front of you instead of waiting for the child society expects you to have to show up. Right? It's about love and acceptance. It's not about, oh, welcome to the world, tiny human. We're so glad you're here. Ooh, but your way of being human, not okay with that. So I want to change you and then I'll love you, right? I'll accept you, but we have to change you first. And so it's very, very important that we can talk about autism. Autism is a different neurotype. It's a different way of being human. Autism isn't an illness. It's not a sickness. It's not a disease. An autism diagnosis isn't an emergency. It's not a cancer diagnosis. Autism is just a different neurotype, a different brain type. And so getting the diagnosis explains the child's neurology and allows the rest of us to better understand how to support them so that we can identify accommodations that allow this child to thrive in a world that's not designed for them. And that's really what we do as providers, is identify those environmental accommodations. We fix the environment, we don't fix the child. Right? We've spent decades and decades trying to fix the child, and all we've done is cause mental health woes, right? So we're done trying to fix children because autistic children aren't broken, as that lady said on page 29, right? They're not broken.
Yeah. Oh, I love it. Cari, thank you for sharing that and sharing that book too. I made a note of it. It's called Sincerely Your Autistic Child.
Yep. Okay. Sincerely Your Autistic Child. Yes. Perfect. It is extremely worth your time. It is so powerful because they are like every third page, or maybe even every page, it's just a different person's letter to their parent. Do you know what I mean? So it's like it's multiple people writing. It's not just one person's perspective. So I really appreciate that too.
Yeah, I love that. Oh, jump into talking about the differences between neurodiversity and neurodiversity affirming, and then how professionals can actually be more neurodiversity affirming. So let's talk about those differences.
Yeah, I think it's really important to know the etymology of words. I always think back to when I was in undergrad. One of the most powerful courses that I took when I was at the University of Iowa was called Medical Terminology. And it was a 1-hour course over one semester, but you only went to class twice. You went for your midterm and your final. Otherwise, it was all self-study. And so this is back before we had computers or laptops or anything like that. And so we would just use 3.5 by 5 index cards and write the prefix or suffix on the front and the definition on the back. And I'm telling you, it was the greatest course I ever took because now I can look at any word and I can figure out the etymology of it. And so neuro means brain. Right? Diversity means differences. So all we're talking about when we talk about neurodiversity is we are acknowledging that every human brain is different, that there are no two human brains that are wired exactly the same. What we as human beings have always been able to acknowledge is that human beings look different, right? We like that concrete evidence. So I can look at a group of people and tell, oh, we have different color skin, different pigmentation, different hair colors, different eye colors, different eye shapes, different height, different weight, like all of that. We get it. Like some people have curly hair, straight hair. So we've always acknowledged that people look different, but we have never acknowledged that people have different brains until the neurodiversity movement came about. And so the neurodiversity is really just a framework for helping us understand that brains function differently and that there are going to be variations in neurological development and that those are natural variations in the human genome, okay? That there is no right or wrong way of being human. And so that's really what we mean by neurodiversity. It just acknowledges there are brain differences, that it takes all kinds of minds, that there's no right or wrong way of being human. Okay. Now,
Yeah, love that.
neurodiversity affirming practices, what that means is it's kind of putting neurodiversity into action. And so it's really hard sometimes to think about, gosh, how do I put neurodiversity affirming practices in just a simple definition? Because usually I just have it like 20 bullet points, like this is what makes somebody neurodiversity affirming. But I was like, wow, how do we define really what those practices look like? What that means is that our services are strengths-based instead of deficit-driven. So as therapists, we're so used to giving a standardized test and looking at where the deficits are and then writing goals to fix deficits. So if you're doing that, if you're writing your goals from standardized tests, you're deficit-driven, right? Does that make sense? You're actually looking at
Hmm.
what the child can't do and you're writing goals to fix that. So that is not strengths-based. I always reiterate that the only thing standardized tests are good for is to determine eligibility into a program, to determine eligibility for services. That's the only thing standardized tests are good for, because you can never be strengths-based if you're teaching to the test, because then you're always focusing on deficits. So we need to stop focusing on so much on what the neurodivergent child can't do, and what we do instead is focus on what they can do. And that's why one of my favorite kind of analogies is to use a rubber band like this. And so I always say what we want to do is stretch strengths. Right? Like how you can stretch a rubber band. So like you put all the child's strengths and interests inside this rubber band. And then what we're going to do in therapy is stretch them. Okay. So that's what we mean by a strengths-based approach instead of deficit-driven. So if you are teaching isolated skills out of context to fix deficits so you can check them off a list, you're not neurodiversity affirming. Okay. So services are strengths-based. They always meet the child where they are at, right? So you look at where they are and you build from there. The primary purpose of our services is to provide environmental accommodations that allow not only autistic children, all neurodivergent children, right? This is, I feel like we're kind of talking specifically about autism today, but you've got to understand that kids diagnosed with ADHD, dyslexia, dyspraxia, dyscalculia, dysgraphia, OCD, they're all neurodivergent. And every human being, not just neurotypical people, every human being has a right to live their life, right? And so we want all neurodivergent kids to be able to live, learn, and thrive as their authentic selves. What we have been expecting for so long is for neurodivergent kids to mask their traits, to mask their way of being human. And basically what that teaches them is that you need to basically be an actor in your own life, right? Your way of being human kind of rubs us the wrong way, us neurotypical people the wrong way. So we need you to change and act more like us, because clearly we're the superior neurotype. And so this is where that term ableism comes from. I'm not sure if you're familiar with that term ableism. I know I'm getting tangential here, but let me share this one story. I was presenting at Kentucky Speech and Hearing Conference, the state conference, a couple years ago, and I had a break in between my two presentations that I was giving. So I decided to attend a course, and the course I walked in on was called Unpacking the Isms of Our Field. And so they started talking about, well, there's a lot of isms. There's racism, there's classism, there's sexism, there's anti-Semitism, there's classism. And they're like, and we can't forget there is ableism. And so this whole course was about really thinking about what ableism is. And ableism is discrimination against disabled people because of the assumption that that typical developing people are superior. And I hope you understand how awful that is, to think that you and I would be superior to someone diagnosed with autism or OCD or ADHD. And so it is just so important that our focus is on fixing the environment, not fixing the child, right? And so that's what we mean by neurodiversity affirming practice. They're strengths based. You meet the child where they're at and you implement environmental accommodations. You fix the environment. And we just want to allow autistic children to be able to live, learn, play, grow, thrive as their authentic selves.
Yeah, absolutely. What are your thoughts about the term neurotypical, or what is like the community's thoughts about the term neurotypical? Is that like inherently ableist?
No, well, no, I know that word typical being in there seems like it would be, but when we really think about, so our society is neurodiverse, and in a neurodiverse society, that means you have the two brain types, the two neurotypes. You have neurotypical and you have neurodivergent. And so neurotypical just refers to people who think, learn, process, and behave in ways that are considered the norm within that culture. And so you've got to understand that what's considered the norm in Kansas City, Missouri is different from what's considered the norm in Los Angeles, California,
Mhm.
right? That's very culturally dependent, regionally dependent. But neurotypical just means that we're not saying that a neurotypical person has an easy life or that they don't struggle in life. It just means they don't need specialized, individualized accommodations to get through their day. It doesn't mean they don't struggle though, but it means that they can make it without those individual supports like an IEP in school, 504 in school, a job coach when they get to work. So neurodivergent refers to somebody who has enough variation to their neurology that it warrants a diagnosis. So what are neurodivergent diagnoses? Autism, ADHD, dyslexia, dyspraxia, OCD, Tourette's, dyscalculia, dysgraphia, all of that. Praxia, if I didn't say that one. So what that means then, that diagnosis just explains this person's brain differences. It explains that they process differently, they experience the world differently, they likely have sensory differences. And all that diagnosis does then, that neurodivergent diagnosis helps us understand that their brain differences mean that they're going to need individualized accommodations. They're going to need individualized services and supports in order to meet their needs. Because we need, again, that diagnosis is so important. If a kid with ADHD doesn't get the diagnosis, then people will apply their own label and they'll say things like, oh, well, he's just lazy. He just doesn't live up to his potential. He's just not motivated. He's just trying to get by without doing the work. He's stubborn. We hear that a lot. Well, no, he has an ADHD brain. So what executive function, what kind of accommodations have you provided to support his executive dysfunction, right? And so that's why we really want to understand you've got neurotypical people and you've got neurodivergent people. We're not suggesting that all neurotypical people have the exact same brain or that all neurodivergent people have the exact same brain. There are no two people on the planet who have the exact same brain. It just means if you're neurotypical, you don't have a diagnosis. If you're neurodivergent, you have a diagnosis that explains your brain differences. So that's kind of
Okay.
the explanation there.
Yeah, no, that's helpful. Do you have any assessments that instead of looking at the child's like deficits and qualifying them through the standardized test, actually look at the environment accommodations?
I don't. I just like in my autism course, what I've done is I've taken all of the traits of autism that I pull off the internet. You go to
Mhm.
red flags of autism and they'll tell you all the things they can't do. So they lack eye contact, they have
Mhm.
poor this, they lack this. And all I've done is I've changed the language to make them neurodiversity affirming. So you can describe the traits, but do it in a way that isn't deficit driven. But as far as an assessment tool, I have that would be amazing to say these are the accommodations that help this child or this person to be successful. But no, I don't know of anything right now. The only way that you can, I'm just not a fan even of the formal test to diagnose autism because they're all so deficit driven. They're all
Mhm.
so focused on what they can't do. And so I just like to use my list of traits, and I just over time as I'm working with the child will go through and start gathering what are the developmental differences and being able to list those social learning differences in that child's, looking at their pattern of development. We're looking for a pattern of differences. One thing to understand, you guys, is there is no single trait that rules in or rules out an autism diagnosis. We can't say something like, oh, well, she makes good eye contact, so she couldn't be autistic, or, oh, well, he doesn't flap or spin, so he's obviously not autistic. Like we have all these stereotypical presentations of autism in our mind, and you have to let all of those go because, yes, some kids do have stereotypical presentations of autism, but I'm telling you, a lot of individuals don't meet those stereotypical, don't have those stereotypical traits.
Mm. Yeah, and I imagine that it has like a lot to do with how the individual feels like they're interacting in their environment, how their parents feel they're able to function within their environment as well. So I know I kind of would like to push back on even standardized tests being good for identifying a deficit, because I feel like it's more about how does that child function within
Function.
their environment.
That's what it's all about. Is there are some people who are autistic, undiagnosed, and it doesn't really impact their ability to live their life, right? They have
Mm.
meaningful relationships, they are able to get and keep a job, they're able to pay their bills on time. And so what I mean, if that for that person who is autistic, they don't experience it as a disability. There are some people who are autistic who do not have a disability. For my son, his diagnosis, his autistic brain does create a disability because my son struggles processing language. He has a lot of sensory differences that make it difficult for him to be in certain environments. And so there's nothing you're going to do to fix Aaron's brain. His brain isn't broken, but does he carry noise reducing headphones with him everywhere he goes? Yes, because when he needs them, he needs them. Does he now self-advocate and ask people to please write directions down instead of just telling him? He's doing a lot of these um, through vocational rehab. He has like these 6-week jog placements, and everybody wants to tell him what to do. And he does not process spoken language very well. And so but he has been reading since he was 2 years old. So he's hyperlexic. So if you can give him a checklist, he doesn't like to read paragraphs, but if you can give him a checklist, my son will not miss a beat. He will not forget to do any chore, any task at work, but I've had to really work with him on self-advocating for his needs, because most people don't write directions down. Most people just tell you, and then you get in trouble when you don't follow it.
Yeah. No, thank you for that. So I don't know how comfortable you feel talking about this or where there's a place for this, but is there a place for behavioral therapy with this
If
population?
I think it's very important, again, that we listen to the community, members from the community whom we aim to serve. And I think it is very important. I have listened to the perspective of some Black autistic parents, and they have made it very clear that that racism is still very much running rampant. And so one of the very interesting points that I have heard Black autistic parents, but also Black parents of autistic children. So the one that I'm thinking of in particular, she herself is autistic as well, and she has an autistic child. But she says, for us, compliance is the answer, because if not, because of the color of our skin, if my son doesn't listen to someone in authority, if a policeman tries to stop him on the street and he isn't compliant, he could get injured. It could be viewed differently than if he had a different colored skin. And so I'm never going to say that, no, we should never do ABA, we should never do behavior therapy, because I have a different perspective as a white parent of an autistic child. So I just want to put that out there, okay? But in general, we are not looking at autism as a behavior disorder, okay? I think historically we've all assumed that it is. That's how we've treated it all along, as a behavior disorder. But we now have a better understanding that autism is a brain difference. It's not a behavior disorder. Because autistic individuals are wired differently, they do have different behaviors. They have different reactions to behaviors. They have sensory differences that make processing sensory input more challenging. And so if you really want to understand behavior, you need to understand the 8 sensory systems. You need to understand dysregulation. You need to understand that instead of calling these challenging behaviors, we need to refer to them as stress responses, right? And so there is actually new research out that just was published in August of this year, Journal of Pediatrics, and determining associations between intervention amounts and outcomes for young autistic children. And it was a meta-analysis. And they looked at something like 144 studies of over 9,000 children who were in intensive behavior therapy. And they wanted to know, okay, does all this intensive behavior therapy lead to more positive outcomes for autistic children? And the research found absolutely not. There is no evidence that intensive behavior therapy actually leads to better outcomes for young autistic children. And so this has been, I mean, just absolutely huge, because
Yeah.
everybody says behavior therapy is kind of the gold standard treatment for autism. One of the things that I think everybody should be very clear on is that we don't treat autism. Okay. You are not neurodiversity affirming if you think you're going to treat autism. What we do is we provide supports and services to autistic individuals. We provide services, supports, and environmental accommodations. Sometimes we make modifications to the curriculum and things like that, but we don't treat the autism. Okay. And so our supports and services really focus on regulation, connection, communication, autonomy, self-advocacy, and motor planning. Like, to me, those are the big issues that we need to be addressing. And so if a child has a stress response and has some kind of a behavior, maybe they're destructive of property, or maybe they're physically or verbally aggressive, whatever that stress response looks at, what we need to be asking is, why is that occurring? We need to be analyzing what triggered that response, instead of saying we need to extinguish that response. Okay. The goal is not just to extinguish the behavior. We need to seek to understand the behavior, and then we change what we do. Okay. And that is kind of Dr. Barry Prezant's words. If you've never read his book, Uniquely Human, A Different Way of Seeing Autism, he talks about how we don't change the child or change the person, we change the environment, we change what we do. And so the onus of responsibility for change, if you're neurodiversity affirming, is on us. It's no longer on changing the child or fixing the child. And so again, that's why I think a lot of times people struggle with shifting to neurodiversity affirming, because we've always focused on fixing the child's deficits, fixing their problems, treating that, right? Because I'm a speech language pathologist, I like to make this kind of distinction that there are certain diagnoses that we do treat. If, as an SLP, if I get a child or a student with a speech sound disorder who has an articulation disorder, let's say, or a phonological disorder, we can treat that, because what that means is we can remediate that, right? With our skilled service, we can actually treat that speech sound disorder and remediate that, and so that the child's speech is more intelligible. But you can't remediate or treat autism. There's no cure for autism, because autism isn't an illness. It's not a disease. It's not a sickness. So we don't treat it. We provide supports, services, and accommodations. And so for me, it's been really important to make that distinction.
Yeah, no, I think that's a really good one. Thank you for sharing that.
Yeah. And so I think that our society is becoming more and more neurodiverse because of something called, boy, I'm going to get into the technical stuff now, but because of something called assortative mating. Assortative mating is a non-random mating system where people with similar traits seem to be attracted to each other. And so what we know is neurodivergent people seem to be attracted to other neurodivergent people, whereas neurotypical people seem to be attracted to people in their neurotype, other neurotypical people. So when two neurodivergent people procreate, what kind of tiny human are they going to have? Well, they're more than likely going to have a neurodivergent child. And so we are seeing that our population is becoming increasingly more and more neurodiverse, and we should anticipate that this is going to continue because of something called assortative mating. So that's from the field of sociology, and I just think that is a really important thing, because you have people saying, from the older generations, well, back in my day, there wasn't all this autism and ADHD, assuming that we're making this up or something. I've got to be able to explain that, well, the thing is back then they didn't give the diagnosis. And so many people from that generation just didn't get diagnosed, never got the supports they needed, and have struggled with mental health their entire life because of that, because of not knowing their neurology, not getting the diagnosis. Also, we have a better understanding of what autism is today than we did, let's say, 40 years ago, 50 years ago. Back in the day, before, let's see, it was like the original DSM, or maybe it was the DSM-2, the Diagnostic and Statistical Manual, there was no autism label back then. And so autistic individuals were given the diagnosis of schizophrenia. And back then, where did we put schizophrenic people? Well, we put them in the institutions, in the sanatoriums, right? So it is, yeah. So we're seeing more and more of these diagnoses, but it's not that we're making it up. It's that we're more aware of it, and that we are doing a better job of diagnosing marginalized communities. So Black and brown children are getting diagnosed with autism more than they have in the past, because we're doing a better job of understanding. We're not yet doing a good job of diagnosing autistic females. We haven't even come close to that. And once we start start diagnosing autistic females who tend to have pretty non-stereotypical traits, you better wait and see. That autism prevalence number is going to skyrocket. Okay, so we've got that, and then we've got assortative mating. So yeah, we're going to continue to become more and more neurodiverse. So this is something that we all have to understand and acknowledge, and continue on our journey to becoming neurodiversity affirming.
Yeah. Wow. Why is nobody talking about
I
assortative
wish,
mating?
I don't know. I'm telling you, I cite it in my presentation. It doesn't, I mean, they've actually done genetic research on parents of autistic children, and they're finding very similar genetic, they're finding genetic similarities in the parents, because we
Yeah.
understand that assortative mating is a real thing. You are attracted to
Right.
people who are like you, like your that have similar presentations, that have similar traits, that have similar brains, that have similar characteristics. So it just makes sense, doesn't it?
It does make sense. Yeah. Similar interests, all of
Hmm.
those things.
Yep,
It makes a lot of
absolutely.
sense. Yeah. Wow. I feel like that is the biggest takeaway from this
Yeah,
presentation, if
I've been blown
anything.
away by it, and nobody ever
Yeah.
talks about it. I go to every autism training I can go to. I read every book, and nobody mentions assortative mating. And I'm like, this is really interesting, because there's research on it. There's documentation on it, and so I think it explains why we are becoming so rapidly, why we're becoming so much more neurodiverse.
Absolutely. Oh, wow. This has been so amazing, so eye-opening so far. But let's talk about the key traits of neurodiversity affirming providers.
Sure. I just picked 5. I think I probably have about 25 traits that I list in my course. And if you follow me on social media, I'm pretty sure I have done posts on it. Maybe I'll do another post on it soon. I feel like it's kind of a thing that's out there now, so I don't like to be too repetitive. But some of the key traits. So it was really good for me to have to pick 5 for today, because again, normally I speak for, hours and hours on this topic. So I think the very first trait is the absolute most important, is that we listen to and amplify autistic voices. It really doesn't matter what Cari Ebert's opinion is on anything, because I'm not actually autistic. Now, I am a parent of an autistic child, so I do have something to say about raising autistic children. But when it comes to understanding how to best support autistic individuals, we listen to actually autistic voices, right? So that's the very first thing. So you need to be following social media accounts of autistic people. You need to only use websites and their information if they are run by neurodivergent people, by autistic, that their voice is actually being amplified. I think the second key trait is really being able to presume competence. And it's important to know what that means. Presuming competence expects an individual to succeed rather than assuming they will fail. And I'll be honest with you, this is why I have an issue with functioning labels and severity ratings. So if I were to come to you and say, "Oh, Vanita, you're going to get this new client, this new child is coming to your caseload, and they have low functioning autism." Well, the minute somebody says a child has low functioning autism, let me tell you what happens automatically. If this is the bar you typically set for new clients, you kind of had this
Mhm.
expectation, "Oh, I'm getting a new client." The minute somebody says low functioning autism, guess what? Right? We go,
Yeah.
"Oh, it's gonna be one of those." So, okay, they're gonna be non-speaking, means we're gonna have to go AAC, they're gonna have tons of behaviors. And so we start doing the eye roll like, "Oh, great, low functioning." So then it's very hard to presume competence, right? And it goes the other way too. If somebody says, "Oh, you're getting this new client, they have high functioning autism." Well, the issue with high functioning autistic individuals is that we often assume then they're close enough to normal, so then they don't qualify for services, so they go their whole life without getting any support services, accommodations, or modifications. We have so many so-called high functioning autistic adults in our society who are barely functioning at all. They can't get and keep a job. They don't have the executive function skills to be able to keep their employment. They maybe aren't paying their bills on time, so they can't maintain housing, and they've worn out their welcome. They keep staying with different family members because they can't get it together, but they've never yet received any supports or services because someone at one point deemed them to be high functioning, to have a high functioning autism. And so that's why
Mhm.
it's really important that we move away from those outdated terms and instead start talking about level of support needs. You and I both support children with high support needs. We support children with low support needs, but you've got to understand those support needs vary, okay, that they are not static, that autism is a dynamic disability. And so it depends on how regulated the child is in the moment. People ask me all the time, is Aaron high functioning or low functioning? And it's the worst question to ask, because it depends on the skill you're talking about. Like, specifically, which activity of daily living are you referring to? Okay. Because if you're talking about dressing himself, he has no support needs at all. If you're talking about, however, you want him to wear a pair of shoes that he has to tie, he cannot tie shoes. So we just don't buy him shoes that tie, because they have slip-ons and Velcro. But if you were going to ask me, how much support does he need for tying shoes? Well, he's high support needs for that. So, I mean, again, you can't just say that someone is either high support or low support. It depends on the actual activity of daily living. And we've got to understand that those needs vary from day to day, from morning to afternoon, depends on if my son is at home versus out in the community. He's always going to have higher support needs away from home. And so it's really important that we shift away from that outdated language that tries to kind of pigeonhole an autistic person into a binary: are you high functioning or low functioning? Are you mild or severe? And instead, just acknowledge that they have, like my son has high support needs for food preparation. He has low support needs for things related to hygiene. But that wasn't always the case. When he was younger, he was high support needs for brushing his teeth and dressing himself and all of that. So I think it's just very important we presume competence. And for non-speaking individuals, a lot of people assume that they don't understand. And so a lot of adults will speak about a non-speaking child in front of them as if they can't hear, as if they see. That's not presuming competence, right? So that's a huge one, is presuming competence. The third one is that we use strengths-based or neutral language to describe developmental differences. So we're done with the deficit-driven red flags, warning signs, can't do this, has inappropriate play with toys. Like, that is not neurodiversity affirming language. Okay. Another trait is that we honor all forms of play and communication. We have got to stop placing a higher value on spoken language over other language modalities. The example I like to share is that every single one of us uses multimodal communication every single day. So when I'm presenting, I like to kind of get my phone and I'll ask people, is there ever a time in the day where you choose to text someone rather than call them on the phone? And everybody in the audience is like, well, yeah, of course. And so I say, so you are choosing written language over spoken language. And is that valid? Well, yeah. Is it acceptable? Yes. Okay. Is there ever a time when someone texts you and you reply with an emoji? Oh, yeah, that happens every day. So you are choosing picture communication over written communication. And is that valid? Yes, that's valid. Is that acceptable? Yes, it is. So then why is it that minimally speaking children or non-speaking children are only allowed to work on spoken language? But I mean, why are all of our goals and our focus on that they have to say the word, everything? And that's part of behavior therapy. They use something called verbal behavior, which is this approach to bring about spoken language, as though that was the only valid method of communication. So if you're neurodiversity affirming, you do not place higher value on spoken language. One thing to remember is that everybody develops language. Not everybody develops speech. Speech is the most finely tuned motor act that human beings perform, and not every autistic individual is going to acquire complex speech, right? And in fact, the research shows that 25 to 35% of autistic individuals never acquire complex speech. Okay, so that's why we honor all forms of communication, and all play is valid. I'm always saying autistic play is authentic play. Do autistic kids like to line things up? Yeah, a lot of them do. They're gestalt processors. And so a lot of kids, autistic kids, they have this vision of what their thing is, their creation is going to look like when they're done. And so my son, I don't know, we used to call it the parking lot, but he would line up his Hot Wheels cars in rainbow form. They were like, it was the most beautiful, aesthetically pleasing thing when it was all done. But I thought that when he was lining up toys back then, that I needed to intervene and grab one of his cars and show him how to play with it the right way. Well, then the problem is I've messed up his gestalt. See, I didn't know this back then. And so then he would just swipe all the cars away, or he'd just walk away, or he'd fall down and cry. And And so everybody was like, well, we need to teach them how to play appropriately with toys. And so I now fully understand that autistic play is authentic play. And you need to understand that autistic children may not always show interest in store-bought toys. They may be very fascinated in the physics of objects and how objects move and how objects spin, roll, and wobble, right? And so if they are, then you're going to, I don't know, use toys that spin, roll, and wobble. You're going to find things that actually meet them where they're at. So that's a huge trait. And then finally, the fifth one is, and I've said this multiple times already, we're going to focus on fixing the environment instead of fixing the child, right? So we're always looking at what are the environmental accommodations, right? Are we going to reduce distractions? Are we going to provide noise reducing headphones? Are we going to add written cues? Are we going to add visual supports? Are we going to add executive function supports? And so you should write those accommodations into your therapy goals, right? When provided with sensory supports, child will. Because you don't always know what those sensory supports are going to be. So it leaves it open for you to, determine that. When provided with visual supports, child will transition between activities. When provided with unrestricted access to multimodal communication, child will express blah, 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 right? So I like to actually write that accommodation right into the goal. And that way we understand the goal is not for them to do this in a neurotypical way, to do this independently. The goal is to do it with supports, with accommodations.
That's a really great point. I want to go back to that what you mentioned about the Gestalt play.
Yeah.
If it is a Gestalt language processor and they're engaging in Gestalt play, which I haven't actually heard about before, so that's really fascinating. Thank you for sharing that. How can you support language in that moment? Are you modeling like a functional Gestalt at that time?
Gestalt language processors it's really important that we follow their lead. And if you never know which phrases or scripts that we say will actually be picked up as a gestalt by the child, right? So we don't determine what the child's gestalts are. We model. I always just tend to model. For my son, it was actually better if I was silent. If I was going to be in his play space, the more I talked, the more he'd put his hands over his ears and start rocking, because he was, a lot of autistic individuals are over responsive in the auditory sense. But as I started understanding, if I'm pressuring him, that's when he's getting dysregulated. And so I stopped pressuring him to play a certain way and just started following his lead because it felt right. It felt more natural. And so just providing some interesting sound effects like, oh man, or crash, or knock it down. And so what happens is when you do provide some interesting, intonationally rich scripts, your Gestalt language processors will often use their delayed echolalia and steal that from you, steal that language from you. And so what we don't want to do is say things like instruct the child to say words. Say choo-choo. Here's a choo-choo. Say choo-choo. Come on, buddy. You can do it. Use your words. Say choo-choo. And then withhold it from them in an effort to try to coerce them to talk like that. And that's what we're all trained to do. Let's be honest. And so the strategies we use for analytic language processors during playtime don't work for our Gestalt language processors. And so that's why it's really important. In the book that I wrote, the Learning to Learn program, chapter 4 of the book is all about autistic play, helping autistic children learn through play, but it's by following their lead. It's by allowing them to lead and we follow. So it's very important. And I'll tell you, learning more about Gestalt language processing, what that does is it leads you down the rabbit hole then to Gestalt cognitive processing. Okay. And so that's where then you start realizing, they are big picture down. They're like this. They see the whole before they see the individual. And so that's what has really helped me to understand my son already has the outcome figured out. So when you change part of the routine, now everything is messed up because he already knows how it's supposed to be. And that's why I think it helps explain why one of the negative things that people say about, autistic people are so rigid, they have inflexible behaviors. Well, the way we reframe that as using neurodiversity affirming language is that they prefer consistency. They find safety in the familiar. They thrive in predictable situations. And so that's why we always would provide visual supports if we're going to change some component of my son's routine so that he can see it and then he can get this new Gestalt kind of figured out.
Wow. Yeah. Anybody you recommend to learn more about the Gestalt cognitive processing?
Yeah, Rachel Dorsey is an autistic
Okay.
SLP and she talks a lot about it. And so she
Okay.
is always my go-to for anything related to kind of that Gestalt and Gestalt processing. And yeah, she's beyond brilliant.
Awesome. Thank you. So, what do you want parents to know?
Well, the main thing is, I think first, autism diagnosis is not an emergency. You don't have to make any decisions immediately. A lot of times, once a child is given an autism diagnosis in the medical community, they will act as though you need to hurry up and make a decision. You need to hurry up and do this. And so there's two autism approaches to consider. Most parents are only told about the first one, though, the deficit driven approach. And that's where they'll say, well, we recommend 20 to 40 hours a week of ABA. We recommend 1 hour a week of speech therapy, and it's usually medical model speech therapy, like in a clinic setting where they're working on fixing skill deficits identified on a standardized test. And so that's the deficit driven approach. And that's usually the only one parents are given. There's all of these, there's specialized schools, ABA schools for autistic kids. And so that's all about exclusion. Your child needs to have something different. They can't be part of society. But we want parents to know that there is a neurodiversity affirming approach. And this is, again, where we build on your child's strengths. It's we affirm their way of being human. So it's back to the rubber band, stretching strengths, not fixing deficits. And so we just want parents to know that you do have a choice, that you do not have to go the medical model route, even though that's the only one that is usually being offered. So it's important for parents to ask questions and to ask for rationale as to why. We've got research now that says intensive ABA doesn't improve outcomes, and I did cite it there on that slide for you guys. And so I just think it's important to understand what the purpose of therapy is. If you're going to put your autistic child in therapy, what's it for? Because it's not to fix their deficits. It's not to treat the autism. And so we need to make sure they understand we are going to identify strategies that will help and provide services and supports and accommodations to help support your child's regulation, both sensory and emotional regulation, to support their ability to connect and build meaningful relationships with other people, and of course, multimodal communication. And so that's really what our emphasis is going to be. But I just don't want parents to think that there's a cure for autism, that if we just hurry up and acted now, that then my child won't be autistic when they're older. Autistic children become autistic adults, period.
And the same would go for neurodivergence too, right?
Yeah,
Like,
you can't outgrow ADHD. You can't outgrow dyslexia. You can't outgrow when you're wired differently. It means you have a brain that functions differently, right? So we don't treat those things. We figure out how that brain learns and then we teach the way they learn, right? And that's really what it's all about.
yeah, I love that. And then I don't know if you have any tips for this, and we might talk about this during the panel, but what do you do or how do you support a family who maybe one family member is more ableist, or maybe they do want more compliance-based therapy? Like, how do you handle those situations?
I think it really is just being patient and finding a way to have difficult conversations,
Mhm.
bringing up the concept of ableism, bringing up the concept of neurodiversity, and finding ways. And I think that's why so many of us as professionals, we just keep making handouts to try to help providers be able to provide a way to kind of structure a conversation. I have autism handouts. I'm in the process of updating them because I have learned so much since I created the first set of handouts. But I think it is just important to be able to try to understand what the parent who maybe is more ableist, to understand where they're coming from. And they probably have some misinformation about autism. And they think that I could tell you horror stories. As I travel around the country, there was one mom who said that the grandma, when her grandson like flaps and rocks, she will slap his hands out in public and say, "You are embarrassing the family. Stop that." And so this poor mom was, because she's a therapist too, so she was in my
Yeah.
training as a therapist and as a mother of an autistic child. And she goes home, both her husband and her mother are horrible. They're like, he can't act like that. He's an embarrassment to our family. We got to get him to stop doing that. So she is like now so struggling because she wants to be neurodiversity affirming, but she is up against it. Everyone in her
Mhm.
family thinks that there's something wrong with him, that he's unacceptable. And so I don't know exactly how that is going to resolve, but I do know we have to be able to talk about it, and we have to be able to, I think that we need more and more counselors who can do maybe family therapy who are neurodiversity affirming. You know what I mean? Because I always
Yeah.
say you and I as SLPs, we would benefit from having more counseling under our belt, having more training on counseling, because that's not what most of us are trained in. And yet that's what we end up spending a lot of our time doing, is dealing with exact situations like you mentioned.
Oh, what a great point. I think that's awesome. And I'm excited to hear from like all of the speakers because we will
Yeah.
have Rachel, the PTSD SLP,
Oh, yes,
joining us. So she might be able to speak to that point
you
and just
bet.
how families are bringing their own experiences into those dynamics too.
Yeah, for sure. For sure.
So here are your references, and everybody will have access to these PowerPoints, so they'll be able to see those. Anything you want to highlight here, or do you want to move on?
Nope. I think that the last one by Sandbank, that is the one that just was released this year in 2024, that says that intensive behavior therapy does not lead to better outcomes for autistic children. It was a meta-analysis. It wasn't a single study. It analyzed 144 other studies. And so there is no evidence that intensive therapy improves outcomes. So that's why I just want to encourage providers to really discuss with parents about making choices that are best for their family instead of this gold standard 40 hours a week of ABA.
Hmm. Yeah, I love that's like so new. So I'm
Yeah,
excited to
brand
take a
new.
look at that.
You bet.
Yeah. So where can everybody find and connect with you?
Yeah, well, if you go to my website, cariebert.com is the website. You can follow me on social media, Instagram and Facebook, Cari Ebert Seminars. So those are the easiest places. If you go to my website, there's tons of information. You can contact me through the website if you have a specific question or anything. But then my understanding is we're going to be doing a follow-up at some point, right?
Yes, yes. We will
Great.
be doing the live panel at the end of today. And if you're watching this as the playback recording, you can also view the recorded panel discussion as well. But Cari, thank you so much. I feel like I could have talked to you for 3 hours or more,
Well,
but
it's not a
we got
problem
it
for
in.
me.
This has been amazing. Thank you again. And I look forward to talking with you more in the panel discussion.
Thanks so much. Appreciate it.